Hi, I'm Megan Kingsley Gale with the Hospital Practice Handbook Project. I want to tell you about a new course, a mini course that we launched called How to Use a Validated Pain Scale in Your Chart Note. 100% of the proceeds from this course goes to benefit the Hospital Practice Handbook Project. The Hospital Practice Handbook Project is a community group, a community space, a space for licensed acupuncturists, East Asian medicine practitioners working in hospital practice to come together, to create community, to share wisdom, and to collaborate. So 100% of the proceeds from this course goes toward benefiting the Hospital Practice Handbook Project. And in one of these sessions where we've been sharing wisdom and trying to figure out what things would help benefit the group and practitioners as a whole is learning more about metrics and clinical measures, and having that available in short courses. So this is the first of those short courses. It's the how to use a validated pain scale in your chart note. And because when patients are coming to us and they have pain, either as their chief complaint or as a secondary tertiary complaint, you want to be measuring that, and you want to be using a validated tool for measuring that. So is the pain scale you're using, is it validated? Has it been validated by research? A validation means it has been validated by scientific research. And is that pain scale, does it fit into your biopsychosocial model of care? Is it part of your patient-centered model of care? So as it turns out, there is a validated pain scale that happens to fit the patient-centered biopsychosocial model of care, and that is the Defense and Veterans Pain Rating Scale. So not only is it a visual scale with descriptions and pictures of expressions and numbers, it also has questions about how does pain interfere with sleep activity? How does pain interfere with function? So it is great to be able to use this as a tool in your patient-centered model of care. So why do we use metrics? Why is it important to measure these things? Well, we need metrics to help us as a tool to help measure change for a patient. So when we use them consistently, we can see and measure change for a patient throughout their course of treatment and throughout a patient population. So when we use a tool consistently, we're able to measure our clinical outcomes. So this is great for the private practitioner, solo practitioner working in practice when you have to report clinical outcomes to the referring provider or to a program such as a workers' comp program or insurance company. And this is great for program leaders to have all the practitioners in your clinic to be using a metric like this consistently, because you do have to collect clinical outcomes measures. So this is one metric, the pain scale metric, to have as part of your clinical outcomes measures toolbox. Because as we know, when you work in clinical practice, you need these tools to help show your change and the positive things that you are doing in your clinical practice. So check it out today. 100% of the proceeds goes toward the Hospital Practice Handbook Project. Thank you.